Hello everybody and welcome back to my vlog. So this week, as you can see straight away, things are slightly different, and there are two differences. One is that I'm not at my house, I'm in someone else's house, and I'm not on my camera because I messed up this morning. But anyway, thank God for iPhones is all I can say. So this week I'm collaborating with somebody because I decided to do a topic in which I didn't feel I had the necessary expertise. So I went out and did some research with somebody who does have that expertise, and also I spoke to a dentist, and I'll be adding in her comments to this as we go along. So what was it that I decided to investigate? And that's the subject of tongue-tie division. Now, tongue-tie division is something that happens in newborn babies or very young babies, babies under 3 months old. And I had noticed as a GP that in a practice I work in, which is reasonably affluent, the area that we sit in, that almost every baby I saw for their 6 to 8 week check had tongue-tie division in the last few months. So this year, every baby I saw. So I started to question that and investigate it. And that's when I decided to involve an expert and see what their opinion was. So I'm just going to hand over now to Clare, who you can see sitting next to me. And this is Clare Byam-Cook, and she's going to introduce herself and tell us what she does and what her expertise is.
Yes, so I'm Clare. I'm a former nurse and midwife, and I've spent the last 30 years helping mothers with breastfeeding problems. And the problems range from can't latch the baby on at all, sore nipples, engorged breasts, mastitis, not enough milk, loads of problems. And in the main, I'm able to sort them because I have a very different approach to how to latch a baby on.
Okay.
Then over the last couple of years, I started hearing, when the mothers were phoning to book an appointment, almost all of them were saying, my baby's got tongue tie, and some of them have had it cut, and others hadn't yet had it cut. And the ones that had had it cut, it clearly hadn't solved the problem, which is why they were seeing me. And almost always, with those mothers who'd had the tongue tie cut, I could latch the baby on quickly, easily, and pain-free. And the ones that hadn't yet had it cut, the same. So in my experience, lots of mothers are spending a lot of money getting tongue-tie cut or having a long wait for an NHS clinic. And in the main, it doesn't seem to be solving the problem at all.
It's really interesting because obviously my experience is that I had a baby whom I breastfed 30 years ago, and I'd never even heard of tongue-tie when I'd had that baby. And I did find breastfeeding that baby very difficult. I did it and it succeeded, and he's now a strapping 6'5" man. But it was very painful. I had cracked, bleeding nipples. Yes. I was using nipple shields, and we didn't have anyone help us. So I just cracked on with it.
Yeah.
Then I had a baby, as everybody who watches my vlog knows, 9 months ago, and I breastfed her too. And actually I didn't have cracked, bleeding nipples this time. It was a little bit uncomfortable at points, but it was far better. And the only thing I could say is that she fed for a long time. It used to take her an hour to feed, but then I only fed her every 4 hours. So
yes.
she took a good feed for an hour. And she definitely had what would now be diagnosed as tongue-tie, because she had a very visible frenulum and she had notching at the end of her tongue.
Yes.
However, I didn't do anything about it, and she's now a very strapping 9-month-old. So I have that experience with breastfeeding, and I'm sure it's experiences that lots of mothers have. And I think we're going to go into the symptoms just now,
yes.
Claire.
And the thing is, long feeds, nowadays, the last couple of years, it's always blamed on tongue tie. The baby can't suck properly. But actually, some babies just have a weak suck, and you can see when they feed from a bottle. You'll occasionally get a baby that takes 40 minutes to feed from a bottle, and his twin might take 20 minutes.
I have one of those
yes. And the other thing is, how long a feed lasts is actually more down to the mother and how quickly her milk flows than how well the baby sucks. So some mothers have such a fast flow that if they were pumping, they could fill a bottle this full in 10 minutes. Others, it would take an hour.
I struggled to pump.
Yeah, and you don't have to be a genius to realise that if the mother has a very slow flow, her baby is going to need to spend a lot longer feeding than a mother with a fast flow. And it isn't necessarily anything to do with how the baby sucks.
Sure. So, before we talk about what the topic is today, and the topic is definitely tongue-tie division or tongue-tie cutting, which is what it's commonly called, let's talk about tongue-tie. And the posh word, the medical word for that is ankyloglossia.
Yes.
And it is a strip of skin that you all will have seen and you all have that's connecting a newborn baby's tongue to the floor of the mouth. This one under here. And the theory goes that in tongue tie, this is too short. And it's often diagnosed when a baby is having the difficulties we've just talked about, difficulty feeding, losing weight, or mum has terrible nipple pain when she's feeding, which is why I mentioned what I had all of those years ago. So, Claire and I are going to talk about the symptoms of tongue tie. Now, from the NHS website, and there is a whole page on this on the NHS website, they list lots of different symptoms from breastfeeding problems, inability for a baby to stay latched or even to get latched on, feeding taking a long time with short breaks in between, an unsettled or crying baby, a hungry baby, inadequate weight gain, and obviously all babies lose weight in the first 10 days of their life, let's not forget that, and a clicking noise when feeding.
Yes.
So what do you think about those symptoms?
Well, all of those symptoms could be related to tongue tie, but I find the majority of them are related to a bad latch. So if the baby's latched on badly, he's bending the nipple over, which is like kinking a hose pipe, makes it more painful for the mother. The milk flow is a lot slower. If he's not lined up correctly, every time he stops sucking for a second, he comes off the breast because the nipple comes out of his mouth. Lots of mothers have a low milk supply, and it's nothing to do with the baby. And I can say that because I often see mothers with twins where one baby feeds perfectly and the other doesn't. So yes, some of those symptoms can be tongue tie, but in my experience, the vast majority of them are either the baby's latched on badly, and when I latch the baby on differently, the mother instantly finds it better. It's not a question of me saying go away for a week and see. And frequently the clicking stops, the baby feeds faster and so on. So I can usually show that a better latch solves almost all of those problems.
So we often hear about mums, as I did first time around, having very sore cracked nipples, as you've mentioned, a low milk supply, and even getting repeated mastitis, which is an infection of a breastfeeding breast. So you get redness, pain, and infection, fever, etc. So do you think that those problems can be solved just by teaching a woman how to breastfeed properly and getting latched?
Nearly always. You know, I agree. If the baby's latched on badly and not emptying the breast evenly, that can contribute to mastitis. But the big question is it a bad latch or is it tongue tie?
Well, that was going to be my next question. So how could tongue tie cause mastitis?
Well, I suppose I don't think it does, but their argument is that the baby then isn't emptying the breast efficiently, and so one area is not being emptied properly.
Right, okay. So, I mean, it's really interesting, isn't it, that this seems to have come around, this problem with feeding being a much bigger issue and being spoken about more often in the last probably 5 years?
Yes, I would say it's crept up over the last 2 or 3 years for me. Before then, I would see maybe 2 babies a year where tongue tie was even mentioned.
Yeah.
And so it really has become the go-to excuse.
Well, I'd actually never heard of it until in the last year, I would say.
No.
And I'm a GP and I am seeing babies all of the time for problems, you know, with all sorts of things, mums with mastitis and also 6 to 8 week baby checks.
Yes.
Now, apparently we can tell by looking at a baby if it's got tongue tie. And certainly what it says on the websites is that if the baby has difficulty extending their tongue, if they have difficulty moving their tongue from side to side or lifting it up from the floor of the mouth, or if the tongue is notched or heart-shaped, so here.
That's it, yeah.
So if the frenulum is really at the end and really pulling,
Yes.
it will pull the tongue in.
Yes, it will.
Definitely. And as I said to you, I saw this with my current daughter. She definitely had notching, and she definitely couldn't extend her tongue very far. She now can get it to the end of her chin.
Yes.
Because she's got a constant rash here now, and she's got her tongue out the whole time.
Yes.
So it's actually grown with her.
Yes.
And I think we'll come on to the dentist view of that later.
Yes.
So do you see babies who have got those visible signs who you can then get latched on?
I do.
Right.
Very, very regularly. I see loads of mothers whose babies are clicking at the breast, coming off, and all of those things, and they do have a short tongue. Well, actually, I used to diagnose that some babies have a short tongue. It's
Right.
nothing to do with the frenulum. And actually, what's interesting is if the baby has a visible frenulum, that's how we used to diagnose tongue tie, with the notching and everything. Now it's become the extent that if the midwives can't see a frenulum, they say it's a posterior tongue tie.
So when you say can't see a frenulum, because you can always see a frenulum, but what you mean is can't see a short frenulum,
Yes,
or one that's
exactly.
really prominent.
Some babies virtually have none at all.
Right.
So this bit of skin there that's the sort of tongue and the frenulum. Some of them have a very obvious one that goes right to the end, and others it's like that right at the back.
Okay.
But if the one right at the back, or even like that, it's not there at all,
Okay.
the midwives now say, oh, well, it's a posterior tongue tie.
Right.
And so now they have to slice into the base of the tongue, not just the skin, to sort it. Well, I see quite a few babies who've had that procedure done, and some of them end up with ulcers onto their tongue, so it can be quite painful.
So let's come back to that
Yes.
when we come on to
Yes,
the cutting.
sorry.
That's
Yeah.
okay. So we don't really know. I've done the research, and nobody really knows how many babies have a tongue tie that is a proper, diagnosed and problematic tongue tie. There are estimates of anywhere between 4 and 11%.
Yes.
The dentist I spoke to thinks it's lower than that, probably less than 4%.
I would agree with the dentist,
You
yes. Yeah. Well, because every mother that comes to see me is having breastfeeding problems, so I don't see the ones that are fine. And I'm just seeing so many more now with a diagnosis of tongue tie, which I don't think is there. So I would say, I hardly ever agree that the baby's got a tongue tie.
Okay, so we've established now what this diagnosis is and why it's made.
Yeah.
And so the question then comes to this treatment, which to me seems to be a reasonably new treatment. And this is the tongue tie release or division, and that's what it's called officially. And what happens is that usually a midwife, I think some doctors now in some NHS clinics, actually cut the frenulum. So that piece of skin, as Claire was nicely shown with her hand, is actually cut to actually free the tongue. And it's done usually under about 8 weeks.
Yes.
Because the problems with feeding have come up by then. And it's described on the NHS website as a simple procedure, almost painless. And it says some babies stay asleep when it's done.
I'd be surprised with that, but I think it is almost painless.
Okay, do you? Okay,
Yes.
well that's good to hear, and it's interesting.
Just
to
the
know.
bit where they're cutting there, not when they're doing the
back one.
posterior tongue tie.
Okay, so if it's done in older babies or older children, so toddlers, because they're having speech problems as they get older, then it's done via a general anaesthetic.
Yeah.
So I guess what happened was, because I was seeing so many of these and I'd never heard of it before,
Yes.
I just thought to myself, well, hang on a minute. What's going on? Why are we doing this? And what did we used to do years ago? And we'll discuss that, I think, just a bit later. So I had a look at what the NHS website said about the research. And what the NHS website says about the research is that research suggests that most babies who have treatment for tongue tie find breastfeeding easier after. Now, I then did a literature search, as did my dentist friend, and we didn't find any evidence to support this statement on the NHS website at all. We found a few studies, not many. They weren't very big studies, they weren't very controlled, they wouldn't meet NICE standards for committees.
Yeah.
And it said that there may be some reduction in nipple pain, but it seems to be quite transient, that change in nipple pain, a few days.
Yeah.
And there is no evidence for any other benefits, but it did say that more research is needed. And I quite accept that lack of research doesn't mean that there is no benefit. It just means we haven't proven it. But at the same time, we're doing something to a baby which is invasive, for which we have no evidence.
Yeah, well, I would agree, and I sometimes talk about this on the radio, which is, I think, how you first heard of me. And I'll often get a lot of mothers phoning in saying, my baby had tongue tie and unfortunately was diagnosed too late or whatever. But when I ask them, when you had it cut, the mothers with a very young baby will often be sort of, I say, when you had it cut, did it make a difference? And they'll hesitate and go, well, no, not really. And then others will say, no, it didn't at all, but it was because it was done too late. And so a lot of them just think, because they've had it cut, that has solved their problems. And when you say to them, well, did it? The answer is no. And some of them, just to say, some of them will say, gradually over the next few weeks, it got better. But if you ask mothers generally about breastfeeding, they'll often have problems in the early days, and gradually, as they get better and the baby gets stronger, they disappear.
Well, that's quite interesting, and I'm gonna talk about that, but I want to come back to something else because we need to put both sides of this story, obviously.
Yeah.
So the dentist's view, because obviously we couldn't have all three people here today, the dentist's view was that a short frenulum is a naturally occurring anatomical thing in a newborn baby.
Yes.
And that as the baby grows, the mouth grows forward and the tongue and the frenulum grow with it. And the frenulum will stretch over time. And that supports what you're saying, that feeding becomes easier over time because that's what's happening. And certainly in my 9-month-old, she, as I said, definitely had what would have been classified as a tongue tie, and I'm sure someone would have cut it for me. But now she has a tongue that's as long as yours and ours. But I can still see her frenulum. It's very, very
Almost
visible.
all of us, you still have one, because we never had it cut in the past.
Absolutely.
It didn't exist.
And what the dentist also says, that in a very small number of children, it does cause a problem, but it's very, very small, and it can persist into toddler and infant school children, and it can cause problems with speech, and then it's cut under general anaesthetic. So that was her view.
Yeah.
Going back to obviously what you've said, that all of the mothers you see, if they have had tongue tie, say it didn't make any difference. There are lots and lots of mothers, and I know because I'm in a group on Facebook for doctors, 17,000 doctors, and lots of them have had this done, obviously, because it seems to be quite a common procedure. And they would all swear by it, in the main. We had a very heated discussion in there a little while back, which I completely respect, everybody's view. And I would say the majority of mothers in there that had the tongue tie said it really helped. There were some who said it didn't make any difference.
Yeah.
But there are these mothers who feel it does help. So what's going on there?
Well, I think there, because it's doctors, they would be very reluctant to admit that they'd done a procedure on their baby that actually wasn't needed. I mean, I really do think that if there was evidence that cutting tongue tie instantly solved problems, I wouldn't be seeing the number of clients I do who are having problems. So I just think they were being defensive.
Okay, fair enough. I mean, obviously these are all views, and none of us have any evidence for it. But what used to happen, Claire? I mean, the question that's in my mind as a mother and a doctor is, 50 years ago, we weren't cutting tongue tie. What used to happen to tongue tie babies?
With regards to your son, I think the tongue tie believers would say that he had an undiagnosed tongue tie, and had you had it cut, your breastfeeding experience might have been a lot better, but of course we'll never know. But the reality is that all babies grow up healthy, whether or not they have the tongue tie cut, because in this country we do have the option of feeding them with a bottle, whether you put your own milk in the bottle or formula. So if tongue tie is causing such an issue that the mother can't even breastfeed, as long as the baby can bottle feed, you don't need to cut the tongue tie for his health, but you might want to cut it in order to keep breastfeeding going.
Well, so that naturally leads to, if I'd have had his tongue tie cut, would I have been doing it for me?
Yes, but then I think rightly so, because if you're still remembering now, all those years later, how painful it was, I think if it was a simple procedure, when it's just this bit of the skin, it's a simple, quick procedure, and if he had had tongue tie and had had that cut and instantly feeding became pain-free, then I would say it was worth doing.
Okay, or would I have benefited from seeing somebody to show me how to breastfeed?
Well, I think you probably would, because I think if I'd seen you.
Yeah.
But answering your question about what we did in the old days.
Yes.
Well, once I started collaborating with you, I got out all my old medical textbooks, and what was interesting was almost none of them even mentioned tongue tie at all.
No,
And so my midwifery books didn't mention tongue tie at all. And some of the books, slightly more recently, there's a chap called Dr. Christopher Green, who's a paediatrician, and he does mention tongue tie and rants on about it doesn't need to be cut.
Oh, really?
So he says it's become a thing that people think tongue tie needs cutting, and he specifically says it doesn't.
So when I've put this to people who are arguing for tongue tie division, they've said to me that in days gone by, midwives used to slice the tongue tie with their fingernail.
Yes, snip it between their fingernails like that.
So
and you were told by these doctors that that was about 30 years ago. Well, I did my training 30 years ago, and tongue tie was never mentioned. I never once heard a fellow midwife say, I saw a baby with tongue tie and I clipped it. So I don't know where this has come from, but certainly when I was working in the NHS 30 years ago, no mention of tongue tie, no mention of...
So as a midwife, you don't think, or you don't know of midwives slicing it with their fingernails?
I've never heard of a single one who's done it.
Okay.
That doesn't mean to say there aren't ones who have, but I've never heard of it.
What about around the world? What happens in other countries? Do you know?
Well, I was visiting my daughter in Singapore, who just had a baby, and I was chatting to the midwives there in the clinic, and I asked them about tongue tie, and they looked at me totally blankly. What are you on about? And eventually one of them thought that one of the midwives may have seen tongue tie about 6 months earlier. So in Singapore, which has far better breastfeeding rates than us, tongue tie isn't, most of the midwives have never even heard of it.
Well, that's a really interesting point that you make, isn't it? Because our breastfeeding rates are amongst the lowest in Europe. And yet here we are cutting tongue tie to make it easier for mums, to do everything we can to make it easier, which we should, of course. And if you can breastfeed, that's fabulous. So why is it not working?
Well, there's another good example, because as far as I'm aware, our breastfeeding rates haven't improved at all for at least 10 years. So if tongue tie is suddenly being identified and treated over the last 3 years or so, our breastfeeding rate should be rising a lot, and they're not.
Why do you think it is now so commonplace?
Tongue tie?
Well, not the tongue tie,
the diagnosis
tongue tie division, yes.
Well, people are going to hate me for saying this, but I think it's because the midwives are getting less and less skilled at helping mothers to breastfeed, and so they're looking for an excuse. Not my fault, it's tongue tie, you need to see someone else. And in defence of the midwives, in my day, mothers used to stay in for up to 10 days after the birth, so we had up to 10 days with every mother to practice our breastfeeding skills, and now the majority of mothers go home within 24 hours.
Well, I had a C-section this time round, and I went home within 18 hours.
It's
from the
crazy.
recovery room. I didn't even go to the ward. And my little one actually managed to just crawl up me more or less and latch herself on. And literally the only intervention I had was a midwife peering over me going, oh, that's fine. And that was it. So nobody described to me what should be happening. Should it not be fine when I got home? I didn't have anyone talk to me about it. I did take her to some of the weighing clinics that you go to, and there was sometimes a breastfeeding expert there
to help. But the problem is, it's the midwives in the wards. They see a baby who's not latching on, or the mother's saying it's painful, and they just say, oh, don't worry, the baby will get the hang of it later, you go home, settle down, everything will work out. And they don't get the feedback that it didn't work out. And in fact, there's one of our big London hospitals where they have a sort of revolving door where they get discharged from the postnatal wards, and then a lot of the babies are being readmitted to the neonatal unit, dehydrated and having lost loads of weight, because breastfeeding hasn't got sorted. But nobody's going to the midwives in the postnatal wards and saying, look, this mother you discharged saying the baby was feeding fine clearly wasn't, because we've just readmitted.
And of course, we used to get a midwife come to the house every day for 10 days. And now they came to me a little bit more because I had quite a jaundiced little one. But other than that, I think they come about 2 or 3 times. So, you know, again, it's probably down to cuts and funding. So this is all, what it really should be about is really good education for new mums. And let's face it, being a new mum is stressful. The pressure, I think, on new mums today compared to 30 years ago is absolutely massive. You know, we've got books everywhere telling us what to do. We've got pressure from celebrities who seem to just float out there and do it without thinking. You know, we see Kate standing on the Lindo wing after 6 hours in a pair of heels. You know, nobody thinks about the amount of help that these people have behind the scenes and the guidance. And that's what these new mums need. They need proper help learning how to breastfeed. But you're not convinced that the lessons they're getting in breastfeeding, even when they get them, are going to do the trick.
No, I honestly think they're wrong. And my critics say that my advice isn't evidence-based, but almost every mother that comes to see me are using me as a last resort.
Yes.
So they've had their free advice in the hospitals, they've been to the drop-in clinics and so on, and their problem hasn't been solved. And then they come to me and I teach a totally different way of doing it, and instantly the mother says it's better. It's not her saying, oh, I think that's a bit better, and me saying give it a week and come back and see me. So you should look at the astonishment on the mother's face and the father's face when I can latch the baby on in 3 seconds flat, when they've been told the baby's got tongue tie and so on.
I mean, it's really interesting. So I'd never heard of this nose to nipple.
No.
But that's because I never had anyone tell me how to breastfeed.
No.
And for me, it was a very natural thing to use my, you're going to probably be horrified when I say this, my 2 fingers around my nipple to make it more pointy.
Correct, that's what I teach.
Well, that was a natural thing for me. That seemed logical.
Yeah.
And to actually just put her mouth straight towards it.
Exactly.
And that seemed to work.
And this is what I teach. So I teach lying the baby up with his mouth in front of your nipple, and then instead of expecting him to open his mouth wide, you want to make your breast smaller. So like this, if I don't shake the breast, he can only grab the bit of my nipple that's sticking out, or if it's not sticking out, he can't latch on at all. But if you squeeze like that, instantly there's something he can grab hold of. But midwives are teaching mothers to squeeze the other way. They're saying, cup your breast from underneath and put a thumb here. And if you do that and squeeze, the breast goes that shape, and the baby's trying to take a mouthful that way. It's like trying to eat a big burger like that instead of like that. And it is that simple.
I mean, I'm fascinated by this because I think we now have a situation where we have NHS clinics spending money, which is in short supply as we know, cutting tongue ties on babies, which may not need to happen, and for which there is no evidence at all in terms of good quality evidence. And I find that staggering because the NHS rarely does anything or spends money without evidence.
Exactly.
And if it's as simple as getting a baby to latch properly, whether they have, you know, a degree of tongue tie or not, then surely that's where we should be putting our resources. And if the midwives are not given the right message, then it's not the midwife's fault, it's the training's fault, and the message is there being given.
That's it. And when I go into the hospitals, I get 2 different responses. Some of the midwives are delighted to see me. Oh, hi Claire, you've come in to see so-and-so, and can we watch what you're doing? And others are hostile and sort of, why is someone calling you in? We're here to help. Now, I find that very odd because when I was a midwife, I was always trying to learn, and I was learning from my fellow midwives how to do a delivery without the needing to do an episiotomy and so on. And so I would have thought that midwife should have gone, really? Claire, what did you do? You know, can you show me? But no, it's sort of the hostile, we know what we're doing. And of course, what you hear all the time is mothers get so much conflicting advice.
Yes, this is the problem, and it really is a problem. I mean, I'm pleased to hear you say that you think it probably is painless.
Yes.
Because I'm fairly horrified that babies might be having pain. So if it's probably painless, then that's good.
Yes.
I'm still not sure we should be doing anything to a baby because there's a risk of infection whenever you cut anything, and it's not necessary. We think most of the time. Yeah. Most of the time.
Exactly.
So we're not saying that no one ever needs it. We accept, Claire seems to accept, that there are some babies who will need to have this procedure, but the majority of babies don't need it. So really, we should be putting our resources into getting babies latched properly so that breastfeeding can happen, and then maybe our breastfeeding rates will go up.
Absolutely. And what I find extraordinary is I'm forever speaking out, just as I am now, saying I think mothers are being taught the wrong way. And not once ever has the Royal College of Midwives or the NCT or anyone said, can we meet up and have a discussion as to what you think we're doing wrong, and can you prove that what you're doing is correct? And I find that very odd, because they should be thinking, we know our breastfeeding rates are low, roughly 50% of mothers give up within 6 weeks, so something's going wrong. If there's an alternative way of doing it, let's at least look at it. And then I'm happy to concede I'm wrong if they can show me that their way of latching is pain-free and mine isn't.
Absolutely.
But no one's ever suggested that meeting.
Right, I'm going to edit this in.
Yeah.
We were talking about the 2 different types of tongue tie that are diagnosed. And obviously the most common one is when you can see a frenulum that's really pronounced, baby lifts tongue up and you can see it, and there's notching. And that's easy to cut, because it's just a snip here.
Yeah.
But we do hear, and I've seen letters in my GP practice, that a posterior tongue tie was diagnosed. What does that mean?
Well, the posterior tongue tie is diagnosed when this frenulum is not visible, or it's right at the back of the tongue, so they can't see the obvious normal one. And so they say that actually what's happened is behind the base of the tongue, there's this bit of skin that's stopping the baby's tongue stretching forward, and if they cut it, that the baby's tongue immediately becomes longer and the baby can feed better. And I can't absolutely say that.
So, to summarise everything we've talked about
Yes.
today, and thank you so much for letting me come here, there's been a massive rise in the number of babies over the last probably 3 years who are being diagnosed with tongue tie because they're having feeding problems generally, or the mum is having pain when she's feeding. And there is no evidence for it that we can find in the literature search. It's no convincing evidence. And you're convinced that in the children that you see, if they're taught to latch their baby onto the breast properly, then things will improve, and no intervention will be needed on a tongue tie, which the dentist feels is a natural thing that will just grow with the baby.
Exactly.
So is the message to mums really, before you consider having tongue tie cut, even when diagnosed, have some expert advice in breastfeeding, and don't go for the original
The problem is you don't know whether you're getting expert advice on breastfeeding. And I have to say, you probably know I've made a DVD called Breastfeeding Without Tears, which the breastfeeding lobby hate because of the title. And that gets 5-star reviews on Amazon. And that shows my technique of mouth to nipple. And that shows very clearly with real babies how to line them up, mouth shape, and push on quickly. And it gets 5-star reviews from mothers who give great detail about how it's helped them. And the only negative reviews are from health professionals saying Claire knows nothing because she's teaching the opposite to us.
Okay.
So there's an example of you can look at what I demonstrate and then make up your own mind. And I talk at something called the Baby Show several times a year. And I had a doctor come up to me at the last one saying she had seen me demonstrate this technique on morning television. And she said, it made such sense, I immediately latched my baby on the way you said, and she said I couldn't believe it, pain-free instantly. And that was just watching me on a quick clip on television. And she was a doctor.
So I guess the message then is if the method that you've been taught is not working,
try something else.
Try something else.
Exactly.
Before you go cutting tongue tie, try something else.
That's exactly what I would say. And it's like a plumber. If the plumber doesn't fix your leaking radiator, it doesn't matter how nice he or she is, you need another plumber.
Absolutely.
So if the people you're consulting are not solving the problem, just see whether there's a different person, and go to people through word of mouth, from recommendation from friends, rather than just assuming that if there's a breastfeeding drop-in clinic, everyone there is an expert.
Okay, well thank you. What I will do, as I always do, is I will put some information, Clare's information, the NHS sites, and the research that there is in the links afterwards, so that you can have a look for yourself and make up your own mind. But obviously, keep an open mind always. Not everybody's way is the right way, but we've given you some alternatives here, and we've given you a view on something that we think definitely needs more research before we go making it the norm, which seems to be happening.
Brilliant.
Thank you.